Good evening. Welcome to Health Quest. I'm Deborah Arneson, your host for the evening, and we have a terrific show, so don't turn your dial. We have two exemplary physicians this evening joining us to talk about a number of different things, but more importantly, talking about ways that you can help prevent disease and actually assess yourself as you're going through life and going through the stressors of your life. And I had the great good fortune of being introduced to Dr. Bain here and Dr. Weissman through my yoga teacher, so who we're going to have on next week. So you can meet Erin and see how she's doing. But I came to them because I was looking for a way to do breast exams or something as an alternative to mammography, and I heard that you offered the thermal digital imagery at your clinic, which is up north. Right. And it's called the Way to Optimal Health, I believe. Yes. Which is a great name. And this is Dr. Bain and this is Dr. Weissman. So we have to thank them for being here because their days are long and arduous, and they've come all the way down from the north side of Chicago to be here with us, and it's great to have you. So we don't have a lot of time. It goes really fast, you guys. So we're going to have to get out as much information as we can in as little time as possible. So just to begin with, let's start with Dr. Weissman, who we haven't had on the show before. If you could just tell us a little bit about you and where. I know I looked at your wall and I was just amazed. I have never seen more degrees and certifications on a young person's wall in my life, I don't think. So you've studied in Sri Lanka and India, I believe. You've been all over the place.
China, yeah. China? I basically term myself a holistic physician. I have my doctorate in chiropractic and naturopathy, and if I was in Sri Lanka, I would have my doctorate in acupuncture and multiple diplomats in homeopathy, different forms of natural medicine that just allow the body's innate capacity to heal itself work.
Now, studying all these different modalities of healing, how did you ever decide or come to focus on one or two or three, modalities? Just something that you were the most attracted to?
Well, I actually don't focus on any one.
You kind of let it go.
Yeah, and I use the language of the body as a tool for me to understand why the body might be speaking in its particular way. My forte of assessing any person is through muscle testing, through the neuromuscular reflex of kinesiology, and through that I'm able to peel back the layers of an emotional problem, of a structural problem, of a biochemical problem, of a spiritual problem that a person may be experiencing.
Well, I had the good fortune, and it was a bad, what I would term a bad time for me, because it was at the end of like a month of craziness, not sleeping, doing lattes, I think almost every day. Yes, I do bad things. And drinking champagne 2 or 3 nights a week because I was determined to have a really good December and see all my friends, right? So I went up there and I was like, no, I'm not going to do the workup. I'm a train wreck. And they were like, well, I know, you should do it. Well, they were like, you're a train wreck. And I did my workup with Dr. Bain, and he was like, you need to work on some things here, and he prioritized for me with the thermal digital imagery. And then I worked with your homeopathic physician who did the Bach flower remedies for me and the homeopathy, and they kind of put everything in one little homeopathic preparation. And then I worked with Dr. Weissman, which was wonderful in the sense that I did a lot of releasing. I mean, I was very emotional when you worked on me, and then I asked about the bowls. What are those called again?
Those are called crystal healing bowls. The
crystal healing bowls, which they're beautiful, they're magnificent, and he just went directly to this one bowl, and he said, we're going to do this sound for you. And it sounded like the whole universe was filling up with this sound, and I just closed my eyes, and I saw green, and it was just like a big, huge emotional release. It was amazing.
Yeah, we were working with your heart chakra.
We were working with my heart chakra. This is, green. So it was amazing. And it was just, he goes, your heart chakra's closed. And I was like, I work really hard to close that thing sometimes, So we just opened up. And after that, I got pretty darn, laid on my face because I had been really pushing the envelope. And, I'm back to normal, if not even stronger than before. So it's like when your body needs an adjustment, go to these guys, they'll adjust you, and you just turned me around. It was great. I needed it. I needed to put the brakes on, and it happened, so everything's perfect as it is. But your background then is as a chiropractor, and you do holistic medicine. Dr. Bain, you do the same, right?
Exactly.
And we had you on our show last week. But for those who missed you, tell them a little bit about yourself.
I'm also a chiropractic physician, and my forte is also natural medicine. I spent 4 years in Europe, traveling around and studying under certain holistic physicians throughout Europe, and getting the essence of herbal medicine and homeopathic medicine and other forms of natural healing. Yes. yes.
So you had the opportunity.
Then I moved back to the area about 2 years ago. Darren and I went to school together, and we decided to join forces.
Well, the really great thing about knowing the two of you is this. I honestly told our doctor from India last year when I had the breast cancer scare, I said, you know what, from now on I'm going to India. I said, you're my doctor. I'm out of here if I have to fly 26 hours to see you. That's where I'm going. The good news is I can go to Northbrook.
Right, exactly.
Do you know, I mean, honestly, because I honestly haven't met anyone that I would put my life's, you know, well-being into their hands until I met the two of you. So I'm very excited.
Thank you.
Not only to have you in my life, but to be able to refer other women to you. Good. So talk to us about what you do at your clinic. I know your philosophy is, you know, the path to optimal health. That's the name of the clinic.
And it's kind of hard to
encapsulate
it in one word, but we take an approach that's I think when Dr. Weissman will expound on it a little bit, but we just interpret how the body's communicating with us. So we use different forms of diagnostics to see where there's stresses in the body initially. So once we find that particular area of stress, we then want to assess whether that stress is as a result of a physical stress, a chemical stress, or an emotional stress.
How do you do that?
Well, that's through the use of the kinesiology. But
what is kinesiology?
Kinesiology is muscle testing. It's using a muscle and a neuromuscular reflex that's associated with a particular organ system or a gland or whatever we may be looking at in the body. So there's a reflex for everything in the body. So we just happen to know where those reflexes are. And it's kind of like your body communicates with you every moment of every day.
We just ignore it.
We just tend to ignore it. Fortunately for us, we speak the language of the body, and we are able to understand what the body's trying to communicate to the person and help them realize that, help them understand what the body's trying to say to them.
Yeah. It's really an amazing thing because muscle testing allows us never to have to guess. And the
body tells you.
It just tells you. And so the strength or the weakness of a particular muscle that we use, just like if I were to tap on your knee with checking the patellar reflex, it would involuntarily move. The amazing thing, and it's usually it's outside most people's paradigm of reality because they've never experienced it before, but whether I touch on a particular point or think about a particular point and check it through a muscle test, I'm able to assess if you have high or low blood sugar, if your hormones are in balance, if your liver is communicating properly, if you're holding grief in your lungs, fear in your kidneys, resentment in your gallbladder.
Amazing?
It's amazing. It's amazing, and it's so experiential.
Do you find most people find that a stretch for them initially, if they're not seekers?
Yeah, well, if they're not seekers. I mean, we don't advertise.
Right.
I mean, we were asked to come down here, but we don't advertise to get patients. People come on referral basis, and it's, you know, it's a waiting list practice.
But
and
kinesiology has been around forever. I mean, it was used originally in Germany, wasn't it?
Well, George Goodhart.
Right, it's from the 60s, or late 60s, early 70s is when they started using it. It didn't become in full use till the 70s. But there's certain people that have taken those basic tenets, those basic ideas, and built on them. And we have separately and then now together kind of followed some of those people and joined, like some of the people who I followed in Europe. When I came over, I started to talk to Darren about what I had been learning, and he was telling me what he had been learning here. And then from there we started, and it's a great thing about having the type of practice that we do is we communicate continuously with people. And if I'm with a patient and I find something that seems different or seems like, hey, I'm consistently finding this with people, I can walk across the hall and say, hey, would you check this out?
Wait, can I just say something? And I have to speak of my own experience because it was phenomenal. I went into Dr. Bain's office first, and he did the thermal imagery on me. And then I went into Rebecca's,
Dr. Gold, yes.
Dr. Gold's office, and she did the homeopathy, and that's called what again?
Electrodermal screening.
Electrodermal screening, which I love. I mean, I have someone who does it on me at least every 6 or 4 months.
It's an awesome
yeah,
machine.
and that's usually my means of assessing myself. And then I went into your office, and you did the kinesiology on me. And each one of them came up, unbeknownst to the other, with exactly the same 2 interesting points, the liver and the pancreas. All of them. And they're all like coming in, talking to each other, oh, yeah, I got that, oh, I got that, oh, I got this too. And they were, you know, they're right on the money. So it was quite phenomenal to see that, and it was quite phenomenal to kind of gently be handed over from one to the next to the next.
Right.
And everybody said, okay, this is what I see. I mean, Rebecca picked up some things in the pancreas. She said, you know, there's an adenocarcinoma there. She goes, doesn't mean you have it, but it means the pancreas is headed towards trouble.
Right.
And she goes, and then I came into your office, you had picked it up first, and you said, your pancreas is just trashed. And I'm like, yeah, it's been getting champagne and coffee. But it was beyond that. And then I went into your office, and you said, you are holding a virus. You have a mutant virus. You know, picked up, and you know, went through the kinesiology, and you said, you've picked this up from a live vaccine that you had probably as a child. So, I mean, these things are far-reaching, they're deep, they're penetrating, and just because you take great care of yourself doesn't mean that things can't go wrong. You know, I take pretty good care of myself, believe it or not, you know, most of the time. So, you all know. I mean, you're amazing healers and practitioners, so...
You know, the essence is that the presence or the lack of a symptom has nothing to do with if you're sick or actually if you're healthy.
Yes.
Yeah, and so it's really just understanding the multiple ways that the body is communicating with you. And you know, as you were saying, you know, is there any particular avenue in which I choose most of all, or which Dr. Bain or Dr. Gould chooses? And no, the essence is when people come in, we're here to empower you. We're here to empower you, to educate you. If you keep on doing what you've always done, you'll keep getting the same results. So what are the basics of health?
Right.
And the basics of health, they're super simple.
My next question.
Yeah.
Okay.
Well, we'll go right into it.
What are they?
So it's the quantity and quality of your water, your hydration, of your food, of your exercise, of your rest. How do you express your emotions? All those things affect you structurally, your musculoskeletal system. They affect you biochemically, how your different internal organ systems communicate. They affect you emotionally, and they affect you spiritually. So easy: water, food, rest, exercise, and love. So you know, once people start understanding that,
is easy.
It is.
People are just so overlooking of most of it. I mean, they just expect their body to perform and perform.
Right.
And again,
then, well, then all we do is step in and listen to listen to how the body's trying to communicate, and say, where is the roadblock? Because you know, a lot of times people want to say, oh, you guys are healers, and you know, that's nice, but really, we're just assessing why your body's not healing itself, because the body's an amazing, it's an amazing self-healing organism. Right. So what we're doing is we're assessing the roadblocks that's preventing your own body from healing on its own. That's all. And we are all in one. We are friend, coach, motivator, educator, all in one. And you know, when someone comes in with a problem, and we coach them through the problem and get them out of the disease model of medicine and into the health model of medicine. And this person is empowered, and their whole life is changing before their eyes. And you know, they want to give us credit, you know, but it's not about us. You know, it's so we don't take credit at all when someone does turn themselves around. And in the same point, when someone comes in and does half of what we tell them to do, and you know, doesn't really get into the swing of things, we don't take the blame either. So, because it's not about us, and that's the essence of it.
And the people recognize it. And it's interesting now, because I'm sure you saw it all day today, you know, because here's after the holidays, it's the first of the year, you know, people are like, now we're in the swing, we're going to exercise, we're going to eat healthy, so they come back. And the truth is that whether this is, you know, their 5th year of being treated, or whether this is their first time, I'm going to tell them the same thing. This is how you get back on track. This is the way to optimal health. Here's how you do it. This is how you take charge. And it's not some new rocket science. It's nothing that's, you know, newly invented. It's simple. Back to